is Janet Denhart. I'm the director of the Price School Sacramento from University of Southern California and the Chester Newland Professor of Public Administration. I would like to welcome all of you to our event. This is the Houston Flournoy Forum for State Government Criminal Justice Realignment panel. Before we begin, I would like to thank a couple of people. I'll start right up here with Janet Lopez and George Cordero. They are our representatives to the state capitol, and they help with all of our events to make sure that we behave properly and know what to do. I'd also like to welcome all of the audience members. There's quite a few of you from the Capitol. There's quite a few people from the Department of Corrections and Rehabilitation. You are all welcome, and we're honored that you're here. I also want to thank Mulvaney's for the delicious lunch. At least mine was delicious, and I know yours will be too. For those of you who don't know, USC has a center in Sacramento. The Price School of Public Policy offers an MPA degree that can be completed part-time by working professionals in 2 years entirely in Sacramento. If I could have, we also have executive education, and we do policy forums like this pretty regularly. If I could have everybody from the center stand up, Chris and Doug and Paul and Chet. These are all people at the Sacramento Center, and they're more than anxious to talk with you about what we do there and answer any questions. Thank you for being here. I also want to say a special hello to one of our advisory board members, Don Hufford. And we're honored to have Ron Hickman in the audience, who's the former director of corrections under Governor Schwarzenegger. So welcome. Yes, let's give him a We are fortunate to have 4 full-time faculty members, or 5 if we count Chet. We always like to count Chet. And one of our crowning jewels of state policy is our very own Juliet Musso, who's going to be convening and moderating the panel today. She is the Houston Flournoy Professor of State Government in the Sol Price School of Public Policy at USC. She has expertise in state and local government, civic engagement, governance and public management. She served as the director of the Price School's programs in public policy and management, and she's won numerous teaching awards, which doesn't come as a surprise to any of the students that are here, including the USC Mellon Mentoring Award. Professor Musso has a master's degree in public policy and a Ph.D. in public policy from the University of California, Berkeley, but now she's a Trojan. So please welcome Juliet.
Thank you, Janet. I, too, would like to welcome you to our annual forum, which we do every year in the name of USC professor and former state legislator and controller, Houston Flournoy. I want to say just a word about Mr. Flournoy before introducing our panelists. Hugh Flournoy was really remarkable in that he straddled the role of statesman and scholar, not always something that's very easy to accomplish. He started his teaching career at Pomona College and left academia and a tenured position, that also doesn't happen very often, for state service in the 1960s, where he served several terms in the state legislature and then actually served as the state controller. Interestingly, I started my career at the LEO where I audited the budget of the state controller. Not quite as glorious, but that's the connection. In reflecting on his career, Flournoy remarked to one of our former deans, Bob Biller, that the most rewarding thing that he actually found in his many years of service was educating students about both the opportunities and the pitfalls of trying to improve policy and management in the state of California. So Hugh Flournoy really exemplified the value of public service and joining scholarship and service, and also the importance of inspiring students to serve the public. At the same time, he was very much a pragmatist and understood the need for not just students, but also public leaders to take off their rose-colored glasses and discard their ideological blinders so that they could make public decisions that were compromises and that actually improved the state and through practical solutions. There's a Talmudic saying, "He who saves one life saves the world entire." Well, I would like to sort of echo that a little bit by saying that if any of our very good public affairs schools in California can produce one leader who is as effective and pragmatic and committed as Hugh Flournoy, then we will have gone a long way towards meeting the challenges of public leadership in California. So Mr. Flournoy, with assistance of the center's friends and supporters, raised funding for this endowed professorship in state government, which I am honored to hold. And part of the gift was to hold an annual forum that addressed critical issues confronting the state. And really, we can think of few issues as critical as criminal justice realignment. This is a complicated policy issue, difficult to implement, and yet holds the promise to both make our public service, our correction system more effective while also more humane, which is a really important win-win if it can be done effectively. As our speakers no doubt will discuss, with implementation, the devil is in the details, and when we have 58 implementers, it becomes pretty complicated. And so the topic today is to think about the opportunities and challenges facing the state and its constituent counties as they implement realignment. I now have the distinct pleasure of introducing our dream team. This is exactly, when I started looking for folks to serve on the panel, this is the perfect panel. We were very lucky that such qualified and expert folks were willing to come. And I can't cover their full bios or we would finish up this introduction around 1:15 and have 15 minutes for the presentation. But I'm going to start left to right. Matt Cate currently serves as the Executive Director of the California State Association of Counties, or CSAC, where he brings us deep expertise on criminal justice generally and realignment specifically. As I think many of you know, Mr. Cate was the Corrections Secretary under both the Schwarzenegger and Brown administrations and was really responsible for an array of innovative reforms to corrections in California, most notably for this panel, the criminal justice realignment measure. Now, I find it interesting that Matt started with the state and is now representing counties, and actually Linda, to your right as you look, has moved in the other direction. Linda has, she's also a boundary spanner, worked for several decades in Fresno County where she helped implement a number of reforms to their criminal justice system and was the chief probation officer at the time that she left and was appointed by the governor to be chair of the Board of State and Community Corrections. And so she is a liaison to all of the myriad actors that are responsible for effective implementation of criminal justice realignment. We also are fortunate to have Kathy Jett, who also has deep expertise in public safety and has worked several decades in state government. She was most recently in state government Undersecretary of Programs for CDCR, and she now works with California Forward, which is where she's assessing state and county capacity to effectively implement realignment. And then at the end of the table, we have Mia Bird. She's a paisana because not only is she of Italian heritage like me, but also she has a Master's of Public Policy and Ph.D. from Berkeley. So, yay. And Mia actually turned down a teaching position, sadly, with our school to go to work at the Public Policy Institute of California, where she's focusing on a multi-site evaluation of county-level implementation of criminal justice realignment. She's particularly looking at county fiscal allocations, which is going to be a continuing and critical issue in implementation of the measure. As I said, she has a Ph.D. from our Goldman school, and she also continues to teach a course I took when I was there, Introduction to Policy Analysis. So thank you for joining us, Mia. So those of you who have come to one of our forums before know how we organize these. We are going to ask each of the panelists to spend about 5 minutes sharing their expertise and speaking to the question of effective criminal justice realignment. And we tried to provide a lot of time for dialogue, so after they've had a chance to speak, I'll ask 1 or 2 follow-up questions and give them an opportunity to speak to points that were made, and then open up the conversation to the audience. So if you have questions or thoughts as we move through this, please jot them down, and you'll have an opportunity to ask, plenty of opportunity to ask questions. So I'm going to start with Matt. Before we do that, let's just give a round of applause for panelists. Thank you.
Thanks, Juliet. I also want to thank USC and the Price School for convening this meeting. It's a terrific idea, and I'm sure my other panelists join me in thanking you for not only convening, but convening it here at Mulvaney's. You had me at lunch, so that's why you got this great panel, I'm sure. So government and innovation do not usually go in the same sentence. And the reason is that there's all kinds of political risk and practical problems with trying something brand new in government. There's really no reward politically for it, and there's a lot of downside. And so why do we have public safety realignment in California? I thought I would just spend 1 minute giving you a little bit of context. It really starts back when Secretary Hickman became Secretary of Corrections in 2003, 2004, and we added the name rehabilitation into CDCR. And there became a shift to what can we do to reduce criminalization and reduce victimization through evidence-based programs, through rehabilitation, through being smarter on crime, those kinds of things. At that time, the prison population at corrections was pretty accurately, I think, forecast to be about 230 to 240,000 inmates by now. We knew, based on how things had gone from the 90s, what the projection was going to be. Now we have 90 to 100,000 fewer people in prison now today than we would have had we done nothing from 2004 on. So wrap your mind around that for a minute. Nonetheless, despite all the work that Secretary Hickman did and his predecessors all the way through the Schwarzenegger administration and into the Brown administration, and a lot of work was done. I could spend a lot of time talking to you about additional credits and using science to make decisions about incarceration. We still found ourselves, when Governor Brown was sworn into office, with 2 huge problems. One, we had lost the court case, and so we had a prison crowding problem that we had a pretty good sense was not going away. And so we were facing an inmate release order, which everyone agreed was going to be a public safety problem writ large. And 2, we had a $26 billion deficit. And so combine those 2 problems, and the solutions start to narrow themselves very quickly, right? What can we do that both reduces the prison population and doesn't cost a lot of money, in fact might save some money? And that's where the idea came for public safety realignment. The idea being that we don't want to release people from prison. Those aren't all the right people to release. Instead, let's move responsibility to the county level, understanding that that's going to push people who otherwise would have been in prison, they will now be in jail, and understanding that it's a rather inelastic asset, jail and prison beds are, and so some folks who were in jail for the lowest level offenses, misdemeanors, those kinds of things, would need to be pushed out into the community. Well, those are the right people to put back in the community if you have to put someone back in the community, right? And it's also a much less expensive thing to do, because prisons are the most expensive way you can spend public safety money. Especially in a place like California, where the courts literally control almost everything that happens in prisons, and they're not cost cutters. That's not their job. They have unlimited budgets because they just order you to spend your money however they decide. So anyway, pushing responsibility to the local level and then providing a fixed set of funds that locals, including Chief Penner at that time, could agree to and could depend on, really, I think, was the right idea, even though it hadn't been done before. Now, anytime you do something that large, where it's never been done before, you're going to have problems. But again, because of the situation, it had to be done quickly. I think what's been really surprising to me, and now in my role representing all of California's elected supervisors, is that it's worked as well as it has. I think we've been surprised to see that crime has not gone up. Violent crime is the same. Property crime is largely tracking the rest of the country. A blip perhaps in some auto theft and some other specialized issues we need to worry about. But really, that's amazing. Price of corrections has gone down. That's a very good thing. And I think the most important thing, and I'm sure that Linda will talk about this, is that I think that local government public safety officials, sheriffs, probation chiefs, DAs, public defenders, health and human services directors are now working together, largely because they're trying to decide how to spend $1 billion that was sent down to the state, to figure this out. And that has been the best thing about public safety realignment, and I think that's why it's working as well as it is so far.
So tag teaming on my buddy Matt, we actually just switched chairs. You're absolutely accurate when you talk about that. I was sitting at the local perspective, never intended to come to Sacramento, never intended to go to work for the governor, not happy with June Clark because these things occurred, but I was committed to realignment. I was committed to what the administration was doing. I was committed to the policy shift. I think it was a courageous move. And I will tell you a bit of a story as I roll this out, because I think it's important for you to understand how it was when the locals walked into a room with then Governor-elect Brown in the Attorney General's office and Secretary Kate at that time. And basically, the message was, we're at a juncture in time where there are no more appellate rights available to us, and we are now going to begin to create policy and shift a workload, and we need you in the room. And in my opinion, that was a brilliant move, because you cannot ask people to only be in the receiving position when you're going to make this sort of mammoth change to the way we do business in California. At that time, even amongst the ranks of the locals, there was Governor Brown called it at that meeting grieving. I call it heartburn. There was a great deal of unrest, as you might imagine. Some believing that this really will not happen, others believing it was going to happen, but they didn't want their fingerprints on it, and a third body of individuals believing it's coming and we want to craft our own destiny. And I think it was that third category of stakeholders, actually all of us got on board by the end of the shift, that reckoned with the fact this is massive in California. Now, it wasn't uncharted territory, frankly, and I think one thing California does a poor job of is patting themselves on the back for the excellent job they did when they realigned juvenile justice in California. Remember, 3/4 of the juvenile justice population has been shifted back to the locals, and it is now a very seamless system that operates without people pointing to individuals in the juvenile justice system as, well, this would have been a DJJ kid, or this would have been somebody that would have been in this institution. I believe at the time they shifted juvenile justice realignment, we were at about 11,000, maybe even higher in DJJ, and currently it's just over 700, I believe, at this juncture. I tell you that because I'm committed, and I believe that we're going to head there on adult realignment. It will not be an easy road. It is one that is paved with individuals that are watching it roll out and looking for every error that has been made, every crime that is committed by an 1170H individual or a post-release individual, and saying, oh my goodness, realignment is breaking the back of California. I think beyond that, you have individuals that would maybe even consider rolling back realignment. I believe the position that the state and the administration has taken is one where they have committed to the locals' support. They have stayed in the game and offered that support. And I think you have seen a massive paradigm shift where even in the face of things that go wrong, and a friend of mine, I like to quote him on this, bad people are going to do bad things. We never thought that because realignment occurred, we were going to cure the ills of the state of California. But we are reckoning with the fact that this shift has not created havoc, that we are not underground, that we are managing the population, and that the locals continue to work closely with the state to roll this out. With that said, there were some unintended consequences of realignment. There are some policy decisions that still need to be addressed, and some programmatic issues that have to be proven as positive outcomes. We are in the infancy of realignment. I am convinced that all of the stakeholders will stay in the game. I think they are committed to programming and improving outcomes on a local level, and with that you will see both now enmesh systems improve the condition of California's justice system.
Thank you. It's an honor to be here with you today to talk about an area that I have a great deal of passion for, and I'd like to just sort of summarize my perspective by letting you know that I spent about 32, 33 years in state government, either working on the public health side or the criminal justice side. And I've really sort of devoted myself to bringing those two groups together because they've always been dealing with the same people. Perhaps not in the right sequence of time or getting the right service, but they've all been the same individuals. When I left CDCR, I was asked to come to California Forward, again, another position I was honored to take on, because California Forward believes strongly that the changes that were coming about with criminal justice realignment needed as much support, coaching, and encouragement as we could provide counties to undergo the transformation they were about to encounter. So we came on board and started up something called the Partnership for Community Excellence. And since that time, we've been working with a number of counties on policy issues that Linda mentioned that are sometimes very difficult at the local level to resolve because it's a state policy issue. We try to take this on a three-tier approach. We work at the state level to convene experts around a table if there's a policy question that is difficult, things such as split sentencing that you might hear about, or the current issue, which is really capacity. And the other areas that we work in is that we'll select 3 counties this year and move in with those counties and sort of be their coaches. And coaching them on how to use the data that's being developed in realignment to make policy decisions and inform policy decisions. For many counties, this is a very changed culture. We're accustomed to being very fear-based at the local level when we're talking about criminal justice policy. But with the help of organizations like PPIC, researchers in Stanford and other parts of the state, we're actually going to be looking at some data that could help inform policy. That's the fundamental change that we're coaching counties around, because there is a science, there is a criminogenic factor with the offenders that they're dealing with, and there's a science that could be applied on how to deal with those offenders. And this is relatively new discussions in most of our counties. Not so much for counties that were actively in visibly involved in the juvenile reform. That's where we really got our feet wet and brought the science into the state. But now applying that to the adult population for some counties is a little more difficult to swallow. Other counties are embracing it and moving forward fast. The perspective that I'd like to talk about or in the discussion is one that goes like this, is that if counties in the state do not have make an intentional effort to develop alternatives to incarceration, that counties will end up in the same position as the state over the long term. Specifically, we've been looking at the areas of behavioral health. If you look at the statistics in terms of prisoners that were incarcerated in our CDCR, those were the two conditions outside of the crimes that they committed that really drove their criminogenic behavior: mental health, substance use. If we don't start to develop ways of really helping counties build that capacity, they run the same risks that the prisons did, with dealing with capacity issues, dealing with how to get services to the offender population. So I'm going to focus a lot in terms of that nexus between public health and criminal justice at the local level, and the kinds of things that we're doing at Cal Forward to bring those groups together. We just concluded a set of regional forums that we conducted dealing with the other major influx in counties, which is called the Affordable Care Act. And bringing groups, as Matt described, from public safety and public health and health care together to look at enrolling those offenders that are in jail and in prison and on probation onto the Affordable Care Act, considering that now we cover for the first time childless males that are at the poverty level or below. So this is our criminal justice population, and it can 100% pay for the substance abuse and mental health services that they need.
First, thank you to the Price School and Juliet for having me as part of a group of such distinguished panelists and also very entertaining lunch companions. I'm here from the Public Policy Institute of California. I'm a research fellow there. And I wanted to just tell you a little bit about the kind of research we're doing around realignment. PPIC is a research organization, but we are decidedly nonpartisan. We're a nonprofit organization, and our ultimate goal is to inform and improve policy in California. So we try to remain as impartial as possible, and we try to just look at the key questions that people are asking and bring data to bear on those questions. And right now, we're looking at three main sets of questions around realignment. The first set of questions is about funding. And the key issue we're looking at there is how funding has been allocated to counties. What's the formula? What is the model? Does it make sense? And just to brief you a little bit on what we're finding, when we look back and see the model that's been used in the past, it's relied largely on two kinds of data. One is the prison population going into realignment, which is used to project the populations across counties. And another piece of data is the size of the adult population in counties. And bringing these two together, we've tried to get a sense of the burden of realignment. And so what PPIC work introduces into the discussion is thinking also about county characteristics. So how high are poverty rates in counties? How do they vary? What about unemployment rates? What about the tax base? What about rural or urban settings? How do these factors come into play in informing our understanding of how capacity to handle realignment varies by county? And the second factor we've introduced is the idea of incentives. How can we create incentives to further promote the goals of realignment and to reward counties for success? And there's a paper that you can check out if you're interested in realignment funding on our website. The second set of questions are impact questions. So what is the impact of realignment been on crime, on recidivism, on the prison population, and on county jail systems? And what we're generally finding is that although the prison population has declined substantially under realignment and the jail populations have increased, we're not seeing that increase reflect the decline in the prison population. So we're seeing a reduction in incarceration. And then of course the question is, well, are we seeing more crime? That's the logical question. And a recent paper by Magnus Lostrom and Steve Raphael tries to look at, well, are we seeing more crime? And they find a small increase in property crime, but they try to put that in the context of the likely increase in street time that we're experiencing across the state. You can check that paper out too. Since I only have 5 minutes to brief you, I'll run through these. And then on the recidivism question, this is a question that takes a little bit more time to answer, right? Because people have to have some time after they're released and to see what happens to them during that time window. We have some work forthcoming this spring and summer on the recidivism question, and I won't jump to any conclusions now, but we're going to be looking at it in a similar way to looking at the crime question. And then the final set of questions, which are really long-term questions, and perhaps the most important questions, are what are the effective practices under realignment? What are the different things that counties are trying and strategies that they're using? And how can we utilize the fact that we really have 58 county laboratories for realignment policy? How can we use that to learn about best practices? And to try to answer those questions, we have been very lucky to partner with the BSCC and with 11 California counties in a multi-county project. And this is a 3-year project. The goal is to help counties to become capable of using their data to self-evaluate their practices, and also to use the diversity of practices across counties to learn something as a state that can be shared to counties that are not in the study as well as counties that are in the study. And that project involves a lot of components. It involves, for one, collecting a lot of data and bringing data together at the county level with data at the state level. It also involves bringing county agencies together, so to share data, to leave their silos, and realignment has been generally a huge factor in allowing people to communicate across agencies and to consider sharing data. And so it's created this possibility, and so we're trying to work with counties to take advantage of that possibility. So we're hoping to have some reporting in the next few years on effective strategies. We're looking primarily at the use of alternatives to incarceration and the use of rehabilitative services. And what we're trying to do is identify where resources can best be targeted, given that they are limited. So that's what we have in the works. I would love to talk to all of you after.
Thank you. Thank you, everyone. I have a couple of follow-up questions, and I think I will direct them to specific individuals, but then give you all a chance to also state your views. And Linda, one of the things that you noted is that with a reform of this complexity, there are going to be programmatic issues that are going to come up during implementation that the state is going to have to address. Kathy and Mia mentioned a couple of these, one having to do with behavioral health and the need for coordinated health approaches, and then Mia's point about variability in county capacity. And I'm wondering if there are other programmatic issues that you see as important, or programmatic proposals that might be able to address some of these points.
Well, I think both the subject matters they raised are important and very serious programmatic issues that I think I can take apart before I bring up other issues. One being the capacity issue. In California, first of all, when you hear about realignment, you almost always hear somebody say in the second breath, realignment and then early release. And I think that we continue to go on record to say nobody was early released from CDCR by virtue of realignment. Is there early release? Yes, it is at the local level. Did early release exist prior to realignment? Yes. At the time realignment went into law, there were 26 counties, maybe 27, that were already under a federal cap and had issues. Now, obviously, when individuals impacted by realignment are going to spend their time at a local level, in many ways it exacerbated that issue. There have been some efforts in terms of financing county's ability to expand capacity or replace beds locally that are ongoing. AB 900 Phase 1, AB 900 Phase 2. 1022 is the effort to allow counties to have programming space in facilities that weren't necessarily built for long-term offenders. So we have issues in terms of long-term commitments to local facilities. When you look at the governor's budget proposals this year, in there is included a 10-year cap to those terms in an effort to reduce what we recognize as an issue that must be addressed by virtue of realignment. Secondly, you'll see an additional recommendation in there for more money. I know that is criticized often by individuals who think we do not need more jail beds. I happen to believe those program beds are incredibly needed and necessary, and the rollout of those, both with the first phase of the 500 million and now this next one, demonstrate, in my mind, a shift in perspective by jails across the state, reckoning with their needs to do business differently. When we're traveling around the state right now, and I think the governor's been incredibly engaged, and I think we're up to maybe 9 or 10 counties right now where we personally visited with the justice professionals in those areas and listened to the emerging needs. We're certainly hearing about the capacity issue. We're hearing about mental health needs. I think it's a particularly exciting time when you talk about the overlay of the Affordable Care Act as it interfaces with realignment. That is emerging right now. I think that's giving us some hope for our offenders that will have substance abuse, that have substance abuse disorders that can more readily get treatment. So I don't want to go on too long, but capacity alone we could do 8 hours on.
And Matt, do you have have you been hearing things from the counties that are your constituents at CSAC that could add to what Linda was discussing?
Well, one of the things I learned from Kathy Jett when we worked together at Corrections is that the best results in recidivism reduction are where you combine treatment in the last 4 to 6 months of incarceration with aftercare in the first 4 to 6 months on the outside. And one of the things that counties are really focused on now is that handoff. It's now our job. And so we're really hearing from folks, we need to rehabilitate our jail space so that it has now room to do that rehabilitative work for our incarcerated county residents. And so that's, I think, a new focus in terms of what kind of space we're building and how we're using that space. And then secondarily, as she mentions the Affordable Care Act, all of a sudden now, in fact, about a mile from here at the Hyatt, there's about 700 professionals trying to figure out that interaction between the Affordable Care Act and public safety realignment. And that, again, that place that's really fascinating is all of a sudden now these folks, as Kathy had mentioned, are eligible for mental health care and behavioral health care funded through the Affordable Care Act if it's done correctly. Well, now between what the governor's proposing in terms of 1022 and what the folks who I'm sure many of you are aware, the folks in the treatment community who have been talking about this for years and years, now see that we may actually have this combination in place, and we might actually see a big dent in recidivism and overall criminality as a result of those changes.
Did you want to add to that, Mia?
May I add to that? And it's a very exciting time because in combination with ACA, we also have AB720 in California, which actually authorizes county jail systems to act on behalf of inmates to get them enrolled in Medi-Cal or in any kind of insurance coverage that they're eligible for. And this is actually a huge innovation because it allows jails to act as sites of enrollment for a very hard to reach and also a very medically vulnerable population. And so a lot of what we're talking about over at the Hyatt, which I'm running over to after this, is how to logistically make this work, how to get public health agencies and social welfare agencies working together with correctional agencies. But the opportunities are pretty exciting, both for saving money on the jail side for healthcare expenditures, inpatient expenditures, and also for potentially improving recidivism outcomes because of that access to care.
Kathy, did you have?
Well, I think it's that nexus is what's so exciting now. We just wrapped up visiting around 30 counties where we work with teens from jails, from public health, from social services, and really, Matt's CAOs were the catalyst to all of that, bringing that group together, because there's a clear way to save the local AB 109 money by not paying for those services with state funding, but actually drawing down the federal dollar. Now, there's many little minor obstacles in doing that, but we're spending a lot of our time working with counties trying to work through. That's much of the work that we're doing with counties right now, with a partner of CSJ and working with the county CAOs to look at how do we do it. We set up kiosks in the jails. Sacramento jail right now has hired 3 eligibility workers, and they're enrolling people while they're in jail, taking advantage of the 720 law. So there's a lot going on right now for the counties. I don't envy the counties.
Yeah, one more piece of context. Keep in mind that it's not just about what's happening in AB 109. There's also been a huge financial shift associated with the Affordable Care Act implementation, because counties under Welfare and Institutions Code Section 17,000 are the providers of last resort for indigent Californians. Well, that comes with that when the state government gives counties responsibilities, that's a mandate. And to give us a mandate, you've also got to provide funding. Well, that was costing the state about $1.5 billion, and through a negotiation that CSAC just had with the administration, those funds are going to be cut in half, right? Because now a larger number of our residents are going to be covered by Medi-Cal, and so counties don't have as large a burden. But what that also did is incentivize counties to get people signed up early and often, because anybody who's not signed up, we pay. And so now you have healthcare professionals. I'm hearing from the public, the welfare directors, from the Public Hospital Association, from all of these affiliate organizations of CSAC about their desire to get the criminal justice community involved in getting people signed up for Medi-Cal or other forms of healthcare insurance, and that's never happened before. And a really interesting connection now between those two formerly largely separate parts of government.
Anyone else want to speak to that issue?
I think you did a fabulous job.
So I'm interested, a couple of you, Matt mentioned that this is requiring counties to work together in new ways, bringing together actors that may not have worked together before. And Kathy mentioned this need for kind of a shift in attitude. And I think thinking about rehabilitation as opposed to incarceration has been a long coming shift in California. One of my friends and fellow Goldman School alums, Stu Drown, who is the head of the Little Hoover Commission, sort of raised a question to me: what will it take to get counties to have what he called the road to Damascus moment? And I'm just wondering where they recognize that there's a need to really innovate and think differently than counties have for many years. And so I'm just wondering whether any of you would like to speak to that question.
Let me start by saying that, when Realignment came forth, there had been a long, dry period of time wherein local probation departments, adult systems were underfunded. And that went on for years and years and years. And so what you found is the prison system was overutilized because it virtually allowed counties, once they got to a particular level, to move individuals into another system, and the two systems were not accountable to each other in any way, shape, or form. Were counties talking before Realignment? Yes. Did counties have meaningful resources to begin to build capacity within a community and do smart business and to do business in a data-driven way, in a way where they utilize science in terms of assessments and in terms of being able to ensure that incarceration is not the only tool that you have in your toolbox? We're there now. And I think what you're learning as we travel around with the locals is that they reckon with the fact that you cannot incarcerate your way out of the issues that face California right now. And certainly there were some counties that had infrastructures that were diminished by the budget crisis to such an impact that they had to build up some of their ability to do business in a regular fashion. What we're seeing now, the emerging trends we're seeing now, is that programs just continue to roll out after that infrastructure has been accommodated as it needed to be. And I'm really delighted with the number of counties that are using assessment tools, with the number of counties that are providing that soft landing Matt talked about, that have reentry programs within their jail, that move people back out into the community on a softer landing. We're not asking them to be released at 2 a.m. in the morning and make a promise to be at their supervision office in a couple of days, because there's a long road between that release and that ability to show up and do what you need to be doing. So we've trained officers in counties with motivational interviewing. So we've taken the techniques that staff historically used and helped them change the emphasis in how they proceed. And so what we're seeing is counties that are now talking about having the right person in the right bed for the right amount of time and utilizing a number of other alternatives to custody. That may not happen in every county voluntarily, but in my opinion, counties one by one will meet that breaking point and they'll have to create. And now they have funding to do that. So, I think it's promising. Whether or not your mind is in the right space at all times, reality is a great innovator.
This is there's some interesting debates going on amongst and between counties right now, because one of the roles of CSAC is to provide the administration with a suggested approach for dividing the $1 billion that came with public safety realignment amongst the counties. Well, that gets counties' attention pretty quick. And so we have a realignment allocation committee made up of CAOs who meet and are trying to work out this issue. Well, so really you have kind of a couple of different camps, right? You have counties who say, listen, I know that we don't have a lot of impact from realignment in terms of how many offenders are returning to our county, but that's because we've been investing our monies correctly for a long time. So if you talk to Contra Costa County, they will tell you, yes, it's true that we don't have very many people returning from prison to Contra Costa County as a result of public safety realignment, but that's because we never sent them in the first place, because we invested in local reentry and in local programs. And our sister county in San Bernardino didn't do that. And so now, of course, they're getting a bigger hit as a result of realignment, and more people are coming back. That doesn't mean they should get more of this money. Meanwhile, San Bernardino or Riverside or Fresno or whoever says, whoa, you're not that smart. It turns out we all went to college too. But our problem is you don't know our gang problem. And you know what? Your Danville gang problem is not the same as our Fresno gang problem. And so, and moreover, we struggled, and the rural part of our state struggled through the Great Recession more than you did. We don't have Google or Intel as a tax base. We've got almond farmers, and we have folks who are trying to scrape by in a mom and pop shop. And so the budget hit us harder. If you give us some money, we will invest in these programs just like you. So you need to get less Contra Costa and give more to us so we can get started on this and get going. Now, do we have an answer yet? No, they're still talking. But it just demonstrates, I think, the fact that this issue of what are we doing with the funds and how smart are we about how to spend it is I think, real and important still right now.
And is any of the work, oh, I'm sorry, Kathy, go
Well,
ahead.
I don't envy Matt's job there with coming up with an allocation formula that everyone will feel is fair in 58 counties. It has to be one of the most mind-bending. I'm glad that PPIC is putting some time into that as well. But I think what you see when you're working with counties, and we've been able to see quite a few of them in these forums, is that every county has a culture in terms of, if I could be in simple terms, say punishment versus, incentive, if you will, to do well. And the counties, I sort of, with Pat and Linda, I am very impressed with how quickly counties have come to understand that business has to go differently. And it really didn't take that long. The challenge for them is making it work, understanding what resources they have, what resources they need. When you have the courts in your business, like many of our counties do around jails, that dictates a lot of what goes on. You really don't want to do that. You want to prevent that from happening in all the counties that don't have the courts on their back at the moment, because that allows those counties the luxury of making investments in things that are scientifically proven to be effective versus what the court is ordering them to do. Just the case in point, it's CDCR, highest recidivic group that existed in CDCR were in fact our mental health clients. If they came through and they recidivated at a much higher rate than anyone else. But the problem with that is that the courts focused all of the department's attention on what happens when they're in custody. But the science will tell you what you do in custody is absolutely meaningless if you don't provide the same service in the community, if there isn't that handoff that's being discussed at the county level now. So these are the kinds of things that counties are able to deal with that the state was inhibited from dealing with and overcrowded, and we could go on and on. But you don't want the courts telling you how to spend your money. That would be one big message we'd want to convey. And second, to avoid that, you're going to have to invest in alternatives to incarceration.
Mia?
I would just second, based on sort of two sources of experience, I would second Kathy's point that the counties have adapted what I perceive as quite quickly. And one source is going through all those plans and coding them up. What we learned at PPIC is that there's fairly widespread commitment to the use of alternatives to incarceration and to services, at least at the level of leadership. So in directing the realignment plan, those were commonly referred to as the solution or the plan for realignment. And second, just from going around to counties on what we originally thought might be a fool's mission and asking them to spend some significant resources to participate in a statewide study that would help to identify best practices for them, yes, but for other counties as well. And our response was overwhelming. Just a strong, immediate commitment to the goal of identifying best practices and to commit the resources that would be needed. That said, counties are in very different positions, and in one key way that is important, I think, for the future of realignment, and that is their professional capacities. And that's what we're thinking of as both their staff expertise and their technological capacity to collect and utilize their data. And they're trying to build those capacities that would allow them to really do genuine evaluative work and to base decisions on evidence. But that is a limitation in many counties, and it is a real obstacle. And when we see resistance, I think it's largely based on that obstacle.
Well, I think this has been great, and I think a lot of issues have been brought up, and it sounds, I think back to the realignment, early realignment of mental health when the state hospitals were closed under Reagan, and I think the issue there was that the population returned to the counties without financing to support community mental health services, and it's comforting to hear that this seems to be a realignment approach that is more intentional about both providing the population of need, as well as some financing and technical assistance to help serve them. I'd like to actually open it up now to the audience, and I think we have a couple of mics going around. Do you need this one? So if folks have questions, and if you could just identify who you are and where you're from so that we know who we have in our audience.
Hi, my name is Andrea San Miguel. I'm a second-year student in the MPA program here in Sacramento. I was just wondering if we could talk a little bit about the impact of reduced reimbursement rates and the lack of adequate providers, the number of providers for mental health, and how that's creating challenges, or if you're finding solutions to that, especially with inpatient mental health beds for at-risk populations or people who were previously incarcerated. More just open for comment.
Yeah, I think I had a little bit of difficulty hearing your question. I think I heard some of the difficulties with the funding and the provider rates. Was that your other? Yeah. Those are really two historical problems in those public health or health fields of mental health and substance use. Reimbursement rates are low. They continue to be low. Even though we made some major strides, and I have to compliment the governor on the actions taken to expand our benefits for drug treatment in our Medicaid operation, as well as funding that was given for crisis care for the mentally ill. I think one of the tools and one of the discussions happening at the counties is that we first had to overcome, for many bills and many laws for many years, parolees were excluded from services. So they're really just coming around to say, yes, we're going to be dealing with this population. Some of the discussions that are going on currently, besides trying to get provider rates up, and we're advocating strongly for that on the public health side because of the federal dollar. If we increase the rates to providers for substance abuse treatment, you're going to get a better service delivery, and it's going to be paid for the first 3 years 100% by the federal government. So, but we do have to overcome a lot of the financial angst in state government with over-committing resources, because in the third year we'll have to pick up 10% of the funds. The other thing that are being looked at are things like home healthcare homes for parolees and probationers. And there's some really interesting discussions going on now. Legislature passed bills last year that people are looking at in this session to allow things like your very well-organized, what are FQHC look-alike drug treatment and mental health facilities, to authorize them to be health homes for probationers and for parolees, so that they have a place to connect to. There's a lot of excitement about that, but there's also a lot of discussion that's needed in terms of the details. But the rates, I think, will continue to be an issue, and it's brought up every year at the legislature, as it will be this year.
And just to capitalize on an issue that has very little to do with the rates, but has to do with capacity. You know, we continue to hear as we travel around the state that the smaller counties that are in remote areas have enormous challenges, both with drug treatment and mental health treatment. You know, we are talking regionalization of some of that, but simply a continued challenge in the state, regardless of what program you're rolling out. And that is, if you are up in the hills and in very small counties where it is maybe not as attractive to business to come in and immerse themselves in these kinds of endeavors, I don't have an answer for it. Yeah, it's just a challenge.
Yeah, it scares us. I was just in Amador County, and I was talking to their probation chief about, you know, what are they doing for reentry and with people with substance use disorder issues, and they had no answers because there didn't exist in their county. And so what do you do, right? And that's where I think you may have identified kind of right now the biggest problem we're trying to deal with.
The last comment on that is that we had met with various members of the judicial world talking about various things like split sentencing and whatnot. And interestingly enough, the thing that we're hearing a lot about is something that's called Prop 36, number 1, not the most current Prop 36, but a law that is currently on the books that says that if you are a first-time offender, that you're entitled to treatment, but we defunded that program. So we're starting to hear a lot from judiciary and others that it might be time to look at refunding that so that we could build new capacity, particularly in a regional setting, because there aren't enough resources to spread. And outside of sort of telemedicine, there's no real remedy to getting services to Amador County.
Hi, Adam Sutkus with the Center for Collaborative Policy at Sac State University. I'd like to ask a question primarily for Linda and Matt, really from kind of a different angle on implementation. And as Kathy Jett knows, we're in the middle of a process working with California Forward and enjoying the partnership to work on the public engagement question on the side of in the field, working, actually rolling this out. So from Linda and Matt, from your perspectives with the board at the state and then at the seat of working with all the counties, I'd like to get your perspective on how the public engagement has been going from your viewpoint, your vantage point, community-based organizations, the public. And a second question to that, or a parallel but related from my world, is how have you found, as you travel the state, how the community corrections partnerships have been working together? So those two parts.
Community correction partnership, let's start with that. Leadership is leadership, and I think that some counties are very strong, their CCPs are very strong. Some have met often, others met a couple of times, and then set a plan and maybe have not revisited it. If I were to try to give you a percentage of how it is done on regular meetings with the entire CCP engaged, I would tell you I think it's probably around 85% of the counties have that ongoing CCP relationship. Certainly we're talking about funding, and that keeps everybody interested and engaged. I think that's just the reality of how life rolls out. In terms of utilization of CBOs and other stakeholders in the process, yet again, 58 counties, 58 different ways. And so you're seeing that public engagement all over the map, depending on where you are. All of the meetings are subject to the Brown Act and are open meetings. All of them are posted and inviting the public to come in and do that. I can tell you from my own experiences, those were very crowded meeting rooms with many people in the room and many stakeholders with very strong feelings on both sides of the issue that wanted to be heard. I think that'll continue to roll out. As I said earlier, part of the issue was, remember, realignment came on the heels of a serious, budget time like California has not seen in years and years and years. And so what you saw, I think, in its infancy was that people rebuilding infrastructure. And beyond that, you were taking a system, state system, and overlaying it to a county system. It's incredibly complex. And so when we even talk about recidivism, which by the way, 1050 charges us to define as a state very soon in the next year, when you talk about that, you cannot compare CDCR's recidivism rates with that of the counties, because we've changed so many of the factors that apply to that. We've taken what we call the non-non-nons and moved them to the county level. Now, we all know there are serious violent and sex offenders in the non-non-non population, but we have left the serious and violent and sex offenders at the state. And so just by virtue of the division, they'll tell you that those non-non-nons are much more active in their recidivism rates. So it's a difficult, complex issue that is very hard to define, and we're not going to be able to say, doggone it, prior to 2011, CDCR did not have this right, and they had a blah, blah, blah revocation rate, blah, and look at the counties, their revocation rate is blah, 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 because remember, in many, many instances, They are apples and oranges. And we continue to try to roll out meaningful measures. I think what you're seeing counties do, because the funding is significant, is create their own outcome measures, to begin to define their own recidivism, to begin to be very data-driven in the decisions they make. And the CCP has been very powerful in those measures. And the boards, for the most part, has adopted the recommendation of those plans and moved them forward. So I don't know, did I get your question anywhere near the ballpark?
Well, let me.
I feel good about my answer, if that helps you.
Let me add on. That's a heck of an answer.
You
Awesome.
go now.
Just a couple thoughts. First of all, on recidivism rates, any criminal justice professional worth their salt can manipulate a recidivism rate to be whatever they want. If you don't know how to do that, then you haven't been around very long, right? So how do you do that? Well, you quit supervising people. That's a good way, because then they don't get arrested very often. Or if they do get arrested, you quit putting them back in custody, right? And if you are both the policing power, then don't arrest them either. So I mean, there's lots of ways that you can arrest everybody and see it shoot up. Now at the county level, it's easier at the state because you can control multiple aspects at once. And that's why we measured recidivism in 3 different ways to try to eliminate that criticism, right? Arrests, convictions, returns, and felony convictions over 3 years. So it's harder to manipulate. County level, the problem is the police chief can go pick up everybody they want to pick up and boost his or her numbers and make probation look like crap. Right? And so it becomes more difficult. In fact, the week before realignment it was in Mayor Villagrosa's office in LA. And Police Chief Charlie Beck was saying that they had a spike of 500 arrests the previous week, the week before realignment. And I said, oh crap, that's going to be blamed on realignment. Well, and we went back and looked, and one of the problems was they had arrested the same guy 36 times for being drunk in public on Skid Row. Well, congratulations, I think we all feel safer. I guess, so when it talks about engagement, the problem is that you folks are a lot smarter than most people about realignment. And ask your friends, what do they know about public safety realignment? I bet they don't know anything, and they're all probably pretty smart people. If you take a poll of the members of the legislature and ask them to define public safety realignment, other than a few specialists who care and work in this area, very, very difficult. CBOs, you've got a couple of very sophisticated CBOs that are working in this area. The rest of them, nary a clue. So we're kind of working in a bubble here and trying to figure this out before the news cycles start to run that this isn't working based on some anecdote or series of anecdotes that don't have anything to do with whether it's really working or not. And that's kind of the pressure that both state and local government are under to try to get this right as quickly as possible.
And I'm just going to add a statistic out there, and I don't think realignment gets credit for it, nor should they get beaten up for it. But we were in LA 2 weeks ago, and with all the justice professionals in the room, they all agree on one thing, and that is crime in Los Angeles is down 11% across the board. Now, who knows why? Who can take credit? Who can take that? You can rest assured if crime was up 11%, they'd have somebody to pin it on. But so we're seeing anomalies, and I'm always embarrassed to ever even talk data in a room full of you people. Let me help you out here. Academia, I really expect to get detention after this is over. But at the end of the day, the amount of data that we're seeing in the crime rates across the state, some going up, some going down, almost no violent crime is bumping up, but I would check and make sure your cars are out there right now because we're hearing that's going very high. But it's very early in the process to begin to be able to extrapolate that and make some outcome predictions, I think.
And I think that, because this is a well-informed audience, one of the things, I just love data, and I, really respect data, but you need to be careful and watch the period of time that the data is being collected, because it's just nature of the beast. You can't look at something in the future. They're looking at data that passed. And I go back to my experience with Proposition 36. One of the reasons it was defunded was because studies were done on the first cohort of people that came out of Prop 36, and it was released maybe 3 or 4 years into that cycle when we were making huge progress. But it sounded like people weren't even talking to one another, and that there was tremendous failure in the collaboration in the system, where we have fixed that. So again, it's incumbent on the policy people that are working with the researchers to make sure that the data is being rolled out to the public in a way that there's some context and timing put into it. Because it could set back, it basically defunded, and it wasn't the intent. But it fortified an argument that the program wasn't good because its success rate was only 45%. We would have died to have that now, right? But it was defunded because of that. So again, we need the data, we need the information, but we need to make sure it's put out to the general public in context.
Down in Los Angeles, but that system is housed separately from its recidivism data. And I always found that very surprising, that those two things should be integrated, because the questions is how what's going on in the prison relates to recidivism. And now you started getting me very scared, Linda, when if we're defining recidivism differently in every single county, how are we going to go forward with evidence-based policy if the data upon which we need to do this analytics isn't consistent across? So my main question is, what's being done to really come up with the integrated, holistic data system that really enables the state to go forward with evidence-based policymaking?
Mia's going to be better at this, but I want to help you. Go ahead.
You start. Okay.
Mia, go ahead.
Yeah, Mia,
Well, I can tell you a little bit about at least what we're doing in terms of this statewide data collection effort. You know, what Matt said is very true. Different measures of recidivism can be manipulated. So what we're trying to do is to collect a set of different measures that are commonly used. And by collecting data on all of those measures, that enables any given researcher or government evaluator or what have you to impose a definition, but to impose it consistently across locations. And what we're trying to do also is to bring state level data together with county level data. And part of the problem is that those data systems don't always speak to each other. And so it may be hard to track, say, whether somebody was returned to jail custody under realignment from the state level. And that's just one example. I'm not sure if that answers your question.
So talking about the definition, I welcome the fact that counties are defining recidivism and doing it in their county because they're going to measure their success or their outcomes or their lack of success. With that said, recognizing the state's going to need a definition. I think it will be a multifaceted definition. That work is just starting. The legislation gave us a group of stakeholders to be at the table doing that. We had our first meeting at the beginning of January. I think it will be a year-long process to begin to define a number of things. Recidivism is the one we all like to talk about, but beyond that, you know, they want to talk about what does average daily population in a jail mean? It means something different when you apply it to the prison system versus how a sheriff might measure. When you talk about an 1178 individual, which is somebody that's sentenced, you know, pursuant to realignment, sheriffs are counting that differently. They may be charged with an 1170 age offense when they walk in the front door, but as systems do, that those charges change, and at some juncture in their custody status that may change. So all of those things really are going to take a great deal of thought and a very painstaking process to come up with something that manages the data, so BSCC can be that repository and where other entities can come and extract data and, you know, utilize it in some way, shape, or form. We also know there's a number of other databases out there right now that are available to us. And so the other thing we need to do is become that body that is able to identify the many places the various data points are housed. AB 109 did not come with a research body. You all know that the Washington Institute is, highly touted and often discussed, and an entity outside of the government, I believe, attached to a university in Washington. We're not there yet. That's not to say we're not going to be there, but I do think the data is important so other people can look at what we have. But before we begin that, we have a lot of work to do to become a state that's agreed on some very significant definitions.
That's a problem, and it's one that the whole country is paying attention to. So there's funders from all across the country that are watching public safety realignment in California and are spending dollars to get academic organizations and to get nonprofits working on studying this issue. So I think we'll catch up. The Attorney General's interested. Obviously, the governor and the BSCC have the kind of an official place to drive it, and they're trying to get there. We did start way behind. At corrections, we had during the time I was there, we had between 70 and 100 full-time staff in research, right? It's amazing. There's more than any other state in the country, more than the feds. How many did you have, Linda, at Fresno?
0.
Right. So.
Orange County had 1, I knew that.
Right. So just keep that in mind and how far we had to go. But at the same time, when Secretary Hickman was walking the halls of the legislature talking about rehabilitation, I bet more than half of the legislators didn't believe anything worked. And it was revolutionary kind of talk. The same thing was true in 2006 when Kathy joined and started, we had a new undersecretary for rehabilitative programs. Now, you find maybe 1 or 2 guys, but almost everybody now knows that the science has progressed. Almost everybody says we want to invest our money in things that work. Largely I'll give credit to the probation chiefs. They got ready for realignment professionally just in time. And correctional science came along, and we just got lucky on this. I think the governor got lucky, the people of California got lucky, that we went into realignment, at least writ large, at about the same time that the corrections professionals were ready to do the right things. And that was just dumb luck in many respects. And then putting the probation chiefs in charge of those community corrections partnerships and letting them drive with their knowledge on effective reentry programs, that was also a really smart move. And that's why I think in part, even without the data, we did better than we otherwise would have done.
Jeffrey Callison, CDCR. Kathy, I think you said earlier that the counties need to figure out their own alternatives to incarceration, otherwise they'll end up where the state was. Are there any counties that have said or implied we're not interested in doing that?
I don't think we've run into one county that would actually say it. but there are some counties that are just going to take longer to come around. And again, sometimes that is based on the allocation that they were given, the condition of the jail, the fact that there are no treatment programs perhaps available to them. So it's really meant that, my comments there are meant to say that if we don't deliberately, and I mean deliberately, set out to make sure that there are alternatives and there are programs for mentally ill and for substance users, that you end up in the same position. It has to be a deliberate effort. It doesn't happen easily. It is not easy to develop a regional program in Northern California. That is not going to be an easy task. Is it doable? Yes, it is. It's been done. We know how to do it, but it's going to take dedicated resources over a period of time, much like the realignment funds are going to take time to get placed in the appropriate places to support. Much like today, I equate sort of drug treatment, mental health to a degree, but a lesser degree. I think drug treatment is the real difficult problem to resolve from a capacity standpoint. I liken them to where probation was prior to the realignments, where they were expected to do enormous things, but we never gave them any resource to do it. And they had to make those appropriate investments once the population came to them. Over time, I see probation as being a very big consumer of mental health and drug treatment services. And they may actually have more clout than the behavioral health side. They might be able to deal with things like rates. They might be able to deal with things because they want a good outcome. Where the drug treatment system is a very varied system within behavioral health, and more so under the broader health arena. We've never made it a dedicated resource. In fact, when Prop 36, we had just begun to build programs up north, and the funding was reduced. It actually eliminated. And so all those programs were brought down. And so it really, what I'm talking about is that conversation needs to be a dedicated conversation over time with funding attached to it, whether that be funding from the ACA or funding from AB109 or a new source. It's something, if we don't keep our eye on that particular ball, it's very easily left aside and will put counties in a position of having the same churners.
I agree, and let me just say on behalf of California counties, we think that would be a great way for the governor to spend some of his surplus.
I think we have time for one more question before I'm going to turn things back over to my good colleague, Janet Denhart.
My name is Becca Christensen, and I represent the Asian Pacific State Employees Association. And kind of my comment and question to you is 2 or 3 blocks down the road is a safe house for women, and it's both drug and alcohol. I know they're in and out of jail. I don't know whether they've been in and out of prison, but it's in the midst on Capitol Avenue of a regentrified area where we've all invested a lot into restoration of our homes. And I consider these ladies, there's 9 of them always, to be our family. They're beautiful individuals that are working very, very hard on their lives. They're individuals that even you recognize those that don't make it. But even those that don't make it are just contributing forces to the family of our neighborhood. Their home is impeccable. They each have jobs where you don't go by at any point in time and see a leaf in their yard. For me, and walking the dog in the morning, it's just a real light in my life to talk to them. I make it, part of my neighborhood to reach out to them. So my question of you is, there has to be pockets of these where these homes are really working. I mean, how is it that you can link into these stories? Because when you give a human face to this and something that's really working, I think that has value in carrying you forward. So how do you link into what's working and what exists in order to expand what isn't there?
So I like that story a lot. I think, as government, not our strong suit, I'm just going to share that with you. I think our line officers, our people that are on the front lines of agencies all over the state, they're reckoning with a great deal of that. We are highlighting best practices in the state on our website right now. We haven't gotten, frankly, that deep in the weeds to look at particular community-based small programs. We're still talking about what's going on in facilities probably and as an outshoot of a governmental entity, but I respect what you're saying. I think that's a great suggestion. Yeah. Yeah.
Mia, did you want to speak to that?
Surprisingly, yes. I do think that narratives like the one that you've expressed are wonderful ways to illustrate what we see in data. And as long as they're consistent with what we see as an overall trend, they're so effective in conveying an understanding of what the data is telling us. And one of the key challenges right now at the county level is that we don't have, in most counties, a good way of holding providers accountable and also identifying providers that are extremely successful. And that would be a really great first step to try to build the data system so that providers can enter information and that we can understand which providers are having good results and maybe which providers we should stop sending people to. So building that capacity, I think, is a great first step to identifying sort of these narratives of success that are consistent with data.
Would you like to have the last word, Matt?
Oh,
I
yeah.
don't want him to have the last word. Problem for me. What do I see about this?
I haven't got the last word with these three women in my entire life. This is not the last word, even if you close it. Thank you for sharing that. The governor likes to talk about subsidiarity, this idea of pushing government down to the lowest level at which it can effectively function, and that's part of the realignment principle, and I think it's smart. Because it was hard for me in my job as Secretary of Corrections to understand about a little 9-person place where miracles were happening, right? Because the truth is that I heard about some that sounded like that and that weren't, right? And those were killers because they made the news, right? And it was, oh, look at this waste, or look at this particular faith-based group that is not using evidence-based principles, or let's look at, and this other one that sounds just the same and doing a great job, including, integrating faith-based and evidence-based, right? And so it's really hard on that real micro level to get that right. And so pushing government down, I think, is good. We have smart justice videos that CSAC puts on our websites that try to highlight effective programs that counties are doing. At the end of the day, I think Mia's right. We're going to get bad outcomes. Right? We're going to have somebody, it's already happened, somebody who left an overcrowded jail that's impacted by a realignment killed somebody. Right? It's happened already. I don't know if you know that. And at the same time, there's been thousands of people whose lives have been turned around, and there have been thousands of victims prevented, but the problem is every victim has a name. Every victim prevented does not. And so I think it's incumbent on all of us to highlight programs that work to make sure the public is aware that we can do good things and that we're turning generations around. Rod can tell you about folks that there's a travesty among African American community with boys who turn to men who, in this cycle that he struggles with in his community, he's trying to turn that around. That's true in other communities as well. In fact, throughout the Central Valley, doesn't matter what color their skin is, they're struggling with generational crime issues. And breaking that is done in onesies and twosies. It's not done by us. It's done by onesies and twosies. And so again, thank you for sharing that, and appreciate what's going on, and thank you again for this opportunity.
And Juliet, my comment has nothing to do with anything other than the two people that sit to my right. And that is that, my last comment is that we are living right now in a very exciting time, but this is a time. We have a governor that's out there supporting it. This has been an amazing reform. We have Linda Penner sitting at the board, and I don't think we could have found anywhere in the nation a better leader. We have Matt Cate, who is now taking all of his wisdom and knowledge about these issues to the counties. We are fortunate, and I just want to thank you two publicly, because I don't think we'd be having this discussion in large part if it wasn't for Governor Brown and the two people sitting to my right.
I told you I wouldn't get the last word.
Well, I actually want to thank.
I'm good with her.
I want to thank everyone as well, and I want to thank you. My students often get discouraged because we talk a lot about the difficulties of politics, and they want success stories. And so I want to thank all of you for also giving encouragement to our students about the possibility of really positive change in governance. And I would then like to turn things over to Janet for the final farewell for today.
Let's give a round of applause. This has just been a superb. I also want to give a round of applause to Juliet. She did a great job with the and I also want to recognize Juliet Lee, who manages all of these policy forums. This looks easy. It's not. And she makes it all work really, really well. I've done it without her, and I've done it with her. I prefer to do it with her. So thank you, all of you, for coming. I'll remind you again that we do have some information in the back if you'd like to pick it up. And we invite you back. You'll be on our mailing list now, so please come to our next policy forum in the fall. And thank you very, very much.